Number 7. I just can imagine how many questions came in around this, and it was like the holy grail of, when it meant to be a young person. But how is it that a woman orgasms, or how is it that an orgasm is brought on for a woman by self or others?
Really important question. My favorite question. And look, in terms of the questions that came into Dolly Doctor, most of the time the questions from young women were that they weren't achieving orgasm when having sex with their male partners. And it didn't come from young women who are having sex with other women. So that already tells me something. And so my first answer to this question is, who's asking the question? Is it a young woman seeking to pleasure herself and discover her own body and figure out how to give herself an orgasm? That's great. Encourage that all the time.
Yeah.
Is it a young woman like the ones who would write into Dolly Doctor, who has been having sex in different ways with a male partner and is not achieving an orgasm, but is able to do it when she's on her own? That tells us something else again. Is it any person of any gender who's curious about this? So I think whoever's asking the question and why is important to know as well when answering this question. And again, I'm going to sort of a little bit of a soapbox, but I think as I said earlier, when I was the question about how long sex lasts, I think we still live in a world that privileges male orgasm over any other type of pleasure or orgasm. And we still live in a world that depicts unrealistic sex scenes between people in mainstream media, mainstream entertainment, and also mainstream sexually explicit material. And as we know, younger and younger children and adolescents are viewing online pornography, and most of it privileges male orgasm over females. I'm not saying all porn is like that, but that's what most young people are seeing and what most young people are being exposed to before they even come close to having intimate encounters with another person. So it's no wonder, I think, that young people, and especially young women, just aren't quite sure what's going on and why they can't have an orgasm. And I also think young men, we're not doing them any favors either, because they're finding themselves a bit stuck, maybe also wondering what's wrong with their bodies when what they see in porn isn't quite what they think it should be for themselves. And also if they're heterosexual and they're wanting to enjoy sex with a female partner, young men also aren't quite sure what to do because they're not learning that from porn either. So the short answer to the question, though, is that there's no one way to make a woman orgasm. As we said earlier when talking about the G-spot, for most women there's a whole area, and it varies from woman to woman, from encounter to encounter, and it even changes within one sexual encounter as to what part of their body, their genital tract inside the vagina, is most sensitive at that particular moment. So sensitive to touch, whether that's with fingers, a toy, a tongue, penis, whatever it is, that the parts of the body that are particularly sensitive and most likely to increase arousal intensely is just going to be variable all the time. But the common areas are, number one, probably the clitoris, the glands, or the sort of tip of the clitoris. That's probably the most sensitive part of a female's anatomy. But also around the vulva, the opening of the vagina, as we said with the G-spot, up on the front wall, further up inside the vagina. Also the nipples and the circles around the nipples and the breasts in general. The mouth and the tongue, they're erogenous zones. Places like the upper thighs, the skin, the earlobes, the neck, it really varies. And so all touching, stimulating, caressing, all these different parts of the body can help achieve an orgasm for a woman. But, touch alone, physical touch and rubbing alone is not necessarily going to bring on an orgasm if there are other contextual factors that that are operating at the time. So if she's very stressed, if she's in a situation she's not that sure about, if there's been issues with the partner for whatever reason, if the relationship or the history of the relationship or her history of relationships, all of those things can influence her experience of pleasure, arousal, and orgasm at any one particular time. And that goes for everyone, not just for women, in fact. So I guess my answer to, let's say, a young person who wants to have an orgasm and a pleasurable experience with another person, it's really good for young women to to discover their own bodies themselves when they're by themselves. It's really safe to masturbate, and just kind of figure out all the different parts of your body and what turns you on. And then if and when you're having an intimate encounter with another person, to communicate that, for the couple to be able to communicate what feels good, what doesn't feel good, how to change that. And I think that's something I always try to answer in a very short number of words. In answering this question in Dolly Doctor, it's quite difficult in like 150 words, but it is about learning what feels good for you, and also learning how to communicate that and to hear from your partner what they want as well. And certainly trying to mimic what you see online is mostly never going to cut it. That's another kind of really important message.
Yeah. And I think just to add to that, normalizing female masturbation as a way to have those experiences and to learn, because I think that, we're quite open to talking about male masturbation. And in fact, we quite often joke about that, whereas female masturbation still has a lot of taboo and it's not something that's openly discussed. So being able to speak to young women about that's a completely normal, natural and healthy way to start your sex life is not a bad discussion to be having either.
Yeah, and it was a really common question from very young adolescents who wrote to Dolly Doctor. And this goes back to the very first, batch of questions I ever answered in 1993. There's been no change in the number of young adolescent girls who enjoy masturbation and would like to know, if it's okay or not. So
yeah. And I think that's the funny thing that's sort of coming to, answering all these questions, that what it was that we were seeing 20 years ago is still really relevant in 2021. And, have our discussions changed? Like, we're still asking the same questions. Does that reflect on the fact that the way we're providing that education and information needs to change to better align with what it is that young people are actually wanting to know about all things sexual health and relationships? And yeah, definitely something to be thinking of, especially as health promotion officers, how we're getting those messages across, or even those who are online today working with young people. How do we start those conversations and feel really comfortable about talking through some of those things that, are still very relevant today, as you've pointed out?